For this CPCR demo video, this is Silly. Silly has suddenly become unresponsive, so it's time to administer CPCR. I'm going to start by calling out for help, but because there is none, I've got to continue. I'll start by checking the ABCs of emergency situations by checking his airway, breathing, and circulation. I'm going to start by looking in his mouth. All clear. Okay. I'm going to check his breathing, so I'm going to look to see if his chest is expanding at all. I don't see any. Okay. And circulation, I'm going to be looking for a pulse by feeling his femoral artery, and I don't feel one. So this means it's time to administer some chest compressions. Silly is in lateral recumbency. I'm going to use Silly's elbow to show where his heart will be by drawing it back against his chest. So that tells me that his heart's going to be right about here. And I'm going to be using the cardiac pump technique because he's a cat and he's not over 10 kilograms. If he was a dog and he was over 10 kilograms, I would try the thoracic pump technique. First things first, I'm going to give him 2 assisted breathing breaths by sealing mouth to snout. I'm going to close his mouth. And that's 2 breaths for 2 seconds. Next, I'm going to start the chest compression. Okay, so for the cardiac pump technique, I'm going to be using 2 hands placed on either side of his heart. So one's going to go here, the other one's going to go under, opposite to it. If he was smaller, I would be using just my thumb and my palm like this in a C shape around him, but he's not that small. If he was a dog over 10 kilograms, I would try the thoracic pump, in which case I'd be aiming for the highest part of his chest, like this, elbows locked, bending at the waist. Because he is a cat, he's not over 10 kilograms, I won't be doing that. So I've done my 2 breaths mouth to snout, and I'm ready to start the cardiac technique. I've located where his heart is. So when I'm doing my compressions, I'm going to be aiming for around 1/3 to 1/2 depth to compress his chest. I'm going to be doing this for 2 minutes, and then I'm going to recheck his pulse. Start by giving him 30 compressions, followed by 2 breaths. I'm going to do this for 2 minutes straight. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Mouth to snout. Going back over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Another 2 breaths, mouth to snout. And I'm going to continue that pattern for 2 minutes before checking his pulse again for any changes. If I had a group, we would rotate team members every 2 minutes, doing 5 compressions, followed by 1 breath for the same 2-minute duration. All right, so I've done 2 minutes of 30 compressions, followed by 2 breaths. Now I'm going to check his pulse at his femoral artery. I see that his chest is expanding about 30%, which means that he's breathing. All right, it's time to take Silly for some further treatment.